So Judy, tell me how you became interested in hypnosis.
Well, I actually had a fear of dentists, and I was in dental school, and I needed my wisdom teeth extracted. And at the time, one of the oral surgery resident that was going to do the extractions had a roommate in psychiatry that actually did hypnosis, and he sent me to him so that I would be able to go through with it. And I was absolutely amazed at what a difference it made.
What happened? What?
He put me into, now that I know, he put me into a trance and made me nice and very calm, and made the chair that I was sitting in, that I used to be very anxious about, a place of comfort. And when I hit the chair, my body actually relaxed. So it went very, very well. And I had less post-operative complications. I had wonderful healing, and everybody was absolutely amazed at how well I healed, how quickly I healed. I didn't have any swelling. It was fabulous.
I had my wisdom teeth removed, and I did hypnosis with it, and my wife was amazed that I could go to a conference the next day.
Mm-hmm.
You know. If a young dentist were to ask you for, rationale about why to receive professional hypnosis training, what would you tell them?
Oh my goodness, it makes such a difference in your practice, in the way that you practice. Most people are afraid or anxious when they go to the dentist, even those that don't say I'm dental phobic, which frequently many of them do, but the majority of people are a little anxious when they get in a chair. And it's very difficult sometimes to work on them, because when you're anxious, you don't always get numb properly and all sorts of things like that. So it makes your life and their life better. And to be honest with you, nowadays people use more and more, they advertise IV sedation, and they cater to cowards, so to speak. And the way they do that is they put people to sleep and fix their teeth, and then they wake up. So they have that's how they do it. But I've found that, as a real practice builder, that when you put people to sleep, they just want the tooth fixed. They really don't. These people are so afraid that they really don't have a sense of self in the way that their smile, they don't really take care of themselves and their smiles and their teeth that way. They just want the problem fixed because they're so afraid. When you do hypnosis, you empower them and you make them feel better about themselves. And not only are they not afraid of the dentist and they're easier to work on, but then they actually do elective dental procedures, which as a dentist are sometimes more fun, and it pays the bills a lot easier, to be perfectly honest. So I really don't, to me, I think every dentist should do it.
Okay. So say more about how you utilize hypnosis in your practice.
I use it for gagging, to help prevent gagging, people with a strong gag reflex when taking impression or x-rays. I use it for children with thumb sucking habit disorders, as an adjunct to the nighttime occlusal guard to help people stop clenching. I've used it, actually, my one patient that needed me the most, and actually the most proud that I was able to use hypnosis, is medically extremely sensitive to epinephrine. She becomes very toxic and goes, actually it's very fatal to her in a very short amount. So her system doesn't exude it as easily. So she was referred because somebody wanted to put her under, but she was afraid that they would give her epinephrine and she would not wake up because that's what would happen. And so she heard about me and she came to me to do hypnosis. So I used glove anesthesia and numbed the area up. I went with her. She needed a root canal. And I went with her to the root canal specialist, the endodontist. And I don't do root canals. And helped her out. And an hour and 45 minutes later, she did a root canal without ever getting numb. And the root canal specialist was absolutely amazed because the tooth was what we call hot. And normally that tooth, he said he had 2 other patients previously that day that he gave the total amount of anesthetic you could give and they would not get numb because of the amount of infection that was there. He had to put them on steroids for a week, bring them back, and then redo it. And with her, it was one of those, that type of a tooth, and she never budged. And he was absolutely amazed, and she was comfortable and healed well.
How do you introduce it? You know, like with people who had problems with gagging and so on. How do you introduce it to them? What do you say?
Well, I just ask them if they want me to help them. To be honest, I don't always use the hypnosis word because frequently it's just a relaxation procedure. Mm-hmm. And I help them and say, would you like me to help you do this so you don't gag anymore? If I do formal hypnosis, I explain to them about the myths and what have they heard about hypnosis and explain the difference between stage hypnosis and clinical hypnosis, which is big.
How long does that take you to talk about that?
Just a few minutes. Okay. Not very long at all.
Well, professionals and non-professionals have a lot of choices about where they might obtain hypnosis training. What does training offered by ASCH and membership in ASCH offer to the professional?
Oh my goodness. I don't know why anyone would go anywhere else. You have, in ASCH, you have the best of the best, and they're right there for you. And they'll help you. It's such a wonderful, friendly, cohesive group of people, multidisciplinary, that you can call on, an email away. They have a listserv that you put this question out if you need help with something, and all these people help you, and people that are internationally known. And it's a wonderful, wonderful resource. And to be perfectly honest, being in the American Dental Association and other organizations, I've never been in one that is so congenial and so helpful and looking out to make sure that you do well.
How does the multidisciplinary aspect help?
It helps because if I run into an issue that another dentist may not have run into before, I have someone that will help. It also allows me that if I find that this person is a little bit beyond my scope as a dentist, I have people that I know and I'm confident that I can refer them to. And I know their training because I know it's excellent. And I have a referral base.